Have you ever wondered what it would be like to house multiple personalities within one mind? Imagine for a moment a bustling city where every citizen has their own unique personality, their own quirks, their own likes and dislikes. But all of this is happening in one mind. That's a glimpse into the world of dissociative identity disorder, or DID as it's often referred to. Now, let's break down this complex term into a more digestible explanation. The word dissociative refers to disconnection or separation. In this context, it's about a disconnect within an individual's thoughts, memories, feelings, actions, or even their sense of identity. Identity disorder, on the other hand, suggests a disruption in the way a person perceives themselves. Put these two together and you have dissociative identity disorder, a serious psychological condition where a person's identity is fragmented into two or more distinct personality states. Picture a jigsaw puzzle, with each piece representing a different aspect of your personality. Now, imagine if each of those pieces was a whole picture in itself, entirely separate, yet part of the same puzzle. That's what it's like for individuals living with DID. They have different personality states or alters, each with its own pattern of perceiving and interacting with the world. These alters aren't just casual mood swings or different sides of a personality we all experience. They are profound and distinct, each with its own memories, behaviors, and even physical characteristics. One alter might be right-handed while another might be left-handed. It's as if several people have taken up residence in the same body. But it's important to remember that these alters are not separate individuals. They are fragments of the person's identity, created by their mind as a way to cope with traumatic experiences. So to sum it up, dissociative identity disorder is a serious and complex psychological condition where a person's identity is split into different personality states. It's like having multiple tenants living in the same house, but in this case, the house is one's mind. Now that we know what DID is, let's dive into what causes it and how it manifests. Dissociative identity disorder, or DID, is most commonly caused by severe traumatic experiences that occur during the tender years of early childhood. This is a time when a child's personality is still in the developmental stage, and such adverse experiences can result in a disruption of that development. The trauma could stem from persistent physical abuse, emotional abuse, or neglect. The child, unable to cope with the constant onslaught of pain and distress, may resort to dissociation as a defense mechanism, leading to the formation of separate identities or alters within the mind. Now let's talk about the symptoms. The most common symptom of DIE is memory loss that goes beyond typical forgetfulness. Individuals may not remember periods of time, ranging from hours to days, or in severe cases, even years. They may also find themselves in places without any recollection of how they got there, or discover objects in their possession without any memory of acquiring them. This is often due to one alter taking control, while the others are not aware or asleep. Apart from memory loss, individuals with DID often experience mental health problems, such as depression, anxiety, and suicidal tendencies. These can be a result of the underlying trauma, as well as the constant internal struggle and confusion caused by the disorder itself. Another major symptom is distinct personality changes. These are not just mood swings, but profound shifts in behavior, preferences, and even skills. A person with DD may switch between alters, each with their own unique characteristics, such as a different voice, style of dressing, or even language. This can be quite disorienting and frightening, both for the person experiencing it and those around them. These symptoms can often lead to confusion and may disrupt a person's daily life. But remember, understanding and knowledge are the first steps towards empathy and support, both crucial in the journey of those grappling with dissociative identity disorder. Imagine waking up one day and not recognizing yourself in the mirror. This is a reality for some with DID. Dissociative identity disorder, or DID, is like living in a house with many rooms, each room occupied by a different tenant. These tenants, or identities, coexist, each with its own unique pattern of perceiving and interacting with the world. It's not as simple as changing outfits or roles throughout the day. It's more like having different people living inside your head, each with their own distinct voice, style, and even beliefs. Each identity, sometimes referred to as an alter, can have its own name, personal history, and characteristics. They can be different ages, genders, or even nationalities. Some people with DID have a few alters, while others may have dozens. These alters can control the person's behavior and thoughts at different times, each emerging to handle different situations. The personalities are not just different moods or states of mind, they are distinct entities, each with their own memories. Sometimes these memories are not shared between identities. This can lead to periods of lost time where a person with DID doesn't remember what another identity did. It's important to remember that these identities are not the result of an overactive imagination or a deliberate act. They are a defense mechanism, a way for the brain to cope with overwhelming trauma. By creating different identities, the brain can compartmentalize traumatic experiences, allowing the individual to function and survive. Despite this, living with DD is far from easy. It can be disorienting and frightening to lose time or feel like a stranger in your own body. The struggle to maintain a coherent sense of self and reality can be a daily challenge. Yet individuals with DID are not defined by their condition. They are people first and foremost, each with their own strengths, skills, and dreams. They navigate life with a unique set of circumstances, meeting each day with courage and resilience. Despite the challenges, individuals with DID continue to navigate life with their unique set of circumstances. Diagnosis of DID can be a complex process, but it is the first step towards healing. It's important to understand that diagnosing dissociative identity disorder isn't as straightforward as a simple blood test or X-ray. It requires a thorough medical and psychological evaluation. This is because DID often coexists with other mental health conditions like depression, anxiety, and post-traumatic stress disorder. To confirm a diagnosis, healthcare professionals delve deep into the patient's personal history, exploring their past traumas, relationships, and behavioral patterns. Once a diagnosis is confirmed, treatment can begin. The cornerstone of managing DID is psychotherapy, often referred to as talk therapy. This method involves regular sessions with a mental health professional, where patients can discuss their thoughts, feelings, and experiences in a safe environment. Cognitive behavioral therapy, or CBT, is particularly effective in treating DID, as it helps individuals understand and change thought patterns that lead to harmful behaviors or feelings. In some cases, medication may be used to manage co-occurring conditions. Antidepressants, anti-anxiety drugs, or certain types of antipsychotic medication can help to alleviate symptoms of depression and anxiety that often accompany DID. However, it's important to note that there is currently no specific drug to treat DID itself. Self-care strategies also play a significant role in managing DID. These can include regular exercise, a balanced diet, sufficient sleep, and mindfulness practices like meditation or yoga. Furthermore, joining support groups can provide individuals with DID a platform to share their experiences and learn from others facing similar challenges. The road to recovery from DID is not a quick or easy one. It involves patience, persistence, and a strong support system. But with the right treatment plan, individuals with DID can learn to manage their symptoms, improve their quality of life, and even thrive. While there is no cure for DID, treatment can help individuals manage their symptoms and lead fulfilling lives. Let's recap the journey we've been on together in understanding dissociative identity disorder. We've delved into the intricate labyrinth of the mind, unveiling the complex nature of DID. We've learned that this disorder is a profound response to severe trauma, often experienced during childhood. The symptoms, they're wide-ranging, from memory loss to the presence of two or more distinct identities within a single individual. We've explored the many faces of DID, acknowledging that these identities are more than mere characters. They are protective mechanisms, each with its own unique traits, memories, and behaviors. Then, we journeyed through the process of diagnosis and treatment. We learned that it's not about eliminating these identities, but rather fostering communication between them, promoting healing and integration. Remember, mental health matters. Let's continue the conversation and break the stigma surrounding disorders like DID.